So today is basically a holiday. I hope everybody joins in early so that we can start. For doctors, I think there is no holiday. Today we are working and just finished our OPD. Now let us see something in relation to the YouTube or the Instagram live which I had taken. There is a very interesting remedy. First, I'll tell you the symptom and then we'll go to the remedy, how the remedy works. Before that, I hope everybody starts with the question answer session so that the time is not lost. There are a lot of conditions where the patient comes and tells us, Sir, I get up in the morning, I feel heavy in the forehead, I don't want to work, and gradually as the day progresses, I start feeling better. हिंदी में क्या बोलता है पेशेंट, डॉक्टर साहब सवेरे उठता ना सिर भारी भारी लगता है स्पेशली ये फोरहेड पे, और जैसी धीरे धीरे एक्टिविटी होती है फिर धीरे धीरे मुझे अच्छा लगना शुरू होता है. This is how the patient tells us symptom. Or whenever we have this symptom that in the morning waking there is a problem, then we have a lot of remedies like we start with lacasis and then we have stephysagria and a lot of other remedies. It is there. Happy India Medicine, Dr. Babel, thank you so much. So, yeah, what I was telling you, waking. The patient says, Sir, I wake up in the morning with a very heavy head, I don't want to work, and we think about lacasis, we think about sulfur, we can think about calibichrome and causticum is also there, hiparsulf is there. I had a very interesting case, and then I did the case taking, the remedy was not working, it was only partial similimum, it was not working properly. I looked in Mater Medica and I have a habit of reading Mater Medica every day, something or the other. The patient was also suffering from, very bursting headache, pain in the forehead while walking and while talking, heaviness of the head and all. So I wanted a remedy which covers this symptom. So by the time, you get the remedy right, I'll just take one question. Sir, 43 years female having numbness in both legs from feet to hips, while walking, only no numbness while standing. Sitting and living on the floor, she has thyroid. Now, whenever you get this type of symptom, Dr. Ramprasad, numbness, always, try to find out why is the patient suffering from numbness. It could be nutritional and secondary to a disease. For example, you have already told me that the patient is suffering from hypothyroidism. Now, numbness, if it is there, it can be because of some nutritional deficiency, B complex, vitamin B12 and all. So find out that also. But in homeopathy, every symptom is an indication of a remedy. So whenever the patient complains of symptom, especially numbness, now you have a numbness symptom especially in the lower extremities, and you have numbness from hips to the feet. So you can take a generalized symptom numbness, then you can say numbness in the lower extremity, and then if you can get the precise site whether left or right, it would be very beneficial. Or you can also have numbness when it is more in the morning, in the evening, in the night, numbness while sitting, numbness while standing, as you have told. So I would not basically go on the very detailed aggravation and amelioration. Numbness, lower extremities, you must think 3-4 remedies, very very important. One acute remedy which I have used in my practice is Naphyllum, GNAPHYLLUM. Second is Calcarea car, Plumbum metallicum, Pulsatilla calicum, the polycrest. So, and if the patient is having thyroid problem, you will be surprised that numbness, especially of lower extremities, whatever modalities you have told, thyroidinum also covers it. So I think you should start the case with the opening case with thyroidinum, then wait what symptoms are there, and then gradually prescribe the consultation medicine. Also check the vitamin D3 and B12 levels also, that you can advise the patient to make some changes in the diet, and that can also be taken care of. So this is, hello Dr. Mayur, this is okay. So I hope this is okay. And which remedy comes to your mind for which I have discussed the symptoms? Dr. Babel, this remedy I think I have told you, and we have discussed this remedy also in Germany. You open Mater Medica, especially when I am reading Indian drugs, I do refer to Drugs of Hindustan from Dr. Ghosh. You'll be so much surprised to see that when the patient comes and tells you that in the morning when I get up with heaviness of the head, especially forehead, as the day progresses, then I start feeling better. Bursting pain in the forehead while talking, bursting pain in the forehead while walking, only one remedy, and that remedy is kurchi. In I think Instagram live, I told you something about kurchi, fever because with sadness. Only remedy kurchi, and now I'm telling you part 2 of kurchi. Kurchi has a relationship in relation to forehead. Everything in relation to forehead is kurchi. Very, very surprising. It will never come in your repertory chart because we have a habit of analyzing symptom from mind to body. You put 2 symptoms and kurchi is gone. You will not get kurchi. So my dear friends, if the local symptom, remember, if the local symptom is very, very characteristic, you can also prescribe on local symptom. Otherwise, you will never be able to prescribe kurchi on migraine or headache. You only prescribe kurchi for stomach disorder as a bitter tonic or diarrhea. It is there, but this symptom, make sure you prescribe kurchi. And if you prescribe kurchi and if you get results, do write and comment on my YouTube or Instagram live, because this remedies I have used kurchi with fantastic results. I normally share the polycrest remedy. I normally share the matremedic of and the mind of polycrest, but today I am telling you in relation to kurchi. I have not prescribed kurchi only on mind symptom. I prescribed on symptom in relation to head. So in your experience, if you have kurchi and if you think that you have got the change, make sure that you write to me on my Insta or my YouTube live so that it is confirmed that it is working also. Now, one more symptom in relation to kurchi I have seen in my practice, and that is when in mind, if there is irritability with sleeplessness, or when the patient has striking from anger, that also is kurchi. One more symptom in relation to kurchi, please write down in your matremedica. I would say some different matremedica which I always write down in my book so that it becomes my experience. Lot of bursting headache, the patient takes a patient takes a towel, puts ice on it and puts on the forehead, and the patient says I feel better. Or on the head, he puts a towel covered on ice and puts on the forehead or head, and he feels better by cold application. My dear friends, please think about kurchi. One more remedy you must think about, which is absolutely the different modality. That remedy is chili, but the bursting headache is better by cold application, and the remedy is arsenic album. So whenever I have given arsenic album and if it has not worked, I give kurchi for this modality, and it has given me wonderful results. I hope, Dr. Babal, I think I have shared this kurchi with you. I hope you understand. I hope you are understanding the remedy kurchi. I didn't want to today do something about kurchi, but of late I have been getting good results with this symptoms. I'm sharing it with you. Some questions have been scrolled up, so you can write down the question, and I hope that thyroid question has been answered properly. Otherwise, I'll give my experience of symptoms in treating in using kurchi. Experience in the sense, basically, sometimes what happens, my assistants also are working with me, tell me, sir, this is not written in books, how could you prescribe? So this is experience. Whenever you are attending a webinar, a seminar, or you're joining a doctor who is very senior and who has a good practice, do ask that doctor about the experience of using simple remedy also, like sulfur, calcarea, natrum, silicia. He will definitely tell you some symptoms which are very, very surprising, because he has seen in this practice, because he has failed with maybe the set protocol of a given remedy, and then he has prescribed a remedy which you feel, sir, how did you prescribe that? That is the experience that you have to use from a experienced physician. Mind you, that physician has to have a good practice. the consistency of results, and you should your friend or you should have visited a doctor and seen with your eyes that it is working. Otherwise, what happens in social media, there are a lot of different ways of marketing yourself. So it is very important to understand the experience. So this is my experience of using Kurchi. I hope you must have gained something. If I tell you, if you have this symptom, do prescribe Kurchi. Yeah, somebody is asking me on my WhatsApp, sir, anything more about Kurchi? See, I can give you some symptoms of Kurchi also, but I feel this is sufficient. Just one symptom, if you want to write in Kurchi, there are some. Okay, first, I'll just ask Dr. Raha. I'll just phrase that and answer. There's one more symptom in Kurchi which you have in lot of remedies. When the patient has lot of headaches, he says that I press my head. I ask my associate to press the head, and I feel much better. That is also a very very rare indication of Kurchi. That is headache better by external pressure. Kurchi is there. China, Macphos, Belladonna. These are the common remedies, Brownia, we use in a practice, but Kurchi is also there. In Kurchi, it is written by very much hard pressure. The more hard the pressure, the better the patient feels. That is Kurchi, what I have seen in my practice. And of course, remember, cold application ameliorates the headache. That is a very important symptom of Kurchi. And remember arsenic, because arsenic is chilly and still the patient is better by cold application. This is experience. Otherwise, if a patient tells to you that better by cold application, we can never think about a remedy which is chilly. But it is my experience where cold application ameliorates. Do think about arsenic album. I hope this is very very clear. Yeah, Raha. It maybe just a minute. Just take the salam Jan. Hello, walaikum salam, Dr. Raha. I have an obese man, 70s, with swelling on calf and lower leg, dark red looking, and now blisters. Says he's fine and everything is fine. What his legs sorted? It may be cellulitis. Is very obstinate and knows everything. Does not listen to any of his advice. He was very reluctant to give me any medication. He said, it's fine, it's my leg. Okay. I asked what does it prevent him from doing. He said, I can't wear shorts and go for swimming. I want to look normal. He has been swimming for 3 years. He does not move around at all. Sits and sleeps mostly the whole day. He is diabetic. It's about to start driving, so will not be able to type. Okay, no issues. So now we are basically understanding a case where there is swelling of the lower extremities, right? Now, the main thing is that the patient is not concerned about that, and the patient says that he's fine and he does not want to take any medicines maybe, or he says it's my leg, so don't treat that as XYZ what is telling. So now, in these type of cases, there are a lot of rubrics you can take in your practice. The patient, you can say the patient is, what you call very obstinate. The patient, you can have a lot of remedies. Now we know that the patient is sick because he has this problem and he has diabetes also. Second thing also important is that just ask the swelling, the temperature, whether it is heat or cold. Ask one thing also, when he goes for swimming, he likes to swim in cold water, or he feels better with cold water. That is also very very important. Understanding the case, whatever I have got, the 2 or 3 things which are very very important. It could be thrombophlebitis, it could be varicose vein, it could be diabetes, it could be water retention also. See the skin, it is very tense, it is pitting, it is how is the skin also, it is important. Whatever I could understand from this case, 3-4 remedies very very important that you have to think about. First is arnica, second is apis mellificum, third is atropine, atropine purum. Atropine purum patients are very very angry, does not want to listen, they are violent, they want to live in their old world. That is atropine pura. I discussed a case of infertility. I treated with a lot of glands on the neck. Atropine pura cured that case. Carbon sulf, iodum, cinnaberis, belladonna. These are the remedies that comes to my mind. Sorry, experience for addiction cases, alcohol, etc. Yeah. So see, addiction basically, what is it? It is out of control. So whenever there is out of control of something, that is called as addiction. Normally, maybe morphine, nicotine, cigarettes, and alcohol. Now, the patient wants, but he cannot control it. That means the addiction is controlling the patient. If you see Mater Medica, there are remedies which are it is written, useful in controlling tobacco addiction, useful in controlling alcohol. If you go symptom wise, we have remedies like caladium, we have remedies like stephysagre, we have remedies like sulfur. For alcohol, we have a classical remedy, quercus. Now, I have used these remedies with, some have worked, some have not worked. My basically advice to you for addiction would be, take a case, whatever remedy comes to you, syphilitic symptoms, prescribe on that symptom, that will work in the case. First thing. Second, you could take the rubric want of self-control. When the patient wants to leave that addiction but cannot want of. But the patient is not worried, he just wants to drink, smoke. So you can take self-control, loss of. Sometimes the patient comes and tells, sir, I know I only take only this much, 30 ml, 60 ml, and I'm very fine. But sometimes he cannot control it. Then you can take loss of self-control. So this is how I approach my case taking. But I have very few cases who come to me for loss of addiction because they've already been going to some rehabilitation center and doing something, or in the reels and the YouTube, they have already taken a lot of sulfur and a lot of quercus and a lot of caladium. They come to us. That's why I don't prescribe this remedy. I take the whole case and then prescribe. Of course, I look at the syphilitic symptom and syphilitic rubric for prescription. Sir, emergency medicine immediately after electric shock. You can try electricity 30 or 200 in repetition doses. That would work. Otherwise, after electric shock, there's a neuralgic pain or electric shock like pain. You can think about phosphorus, and I've also used remedies like calcarea carb, sulfur, and stephysagre, and those type of cases. I'm sorry, I'm very fast because there are a lot of questions which are unanswered. So if you feel that I have not answered few questions because it is already scrolled up, you can always write same thing. Yeah, so today my doctors who are with me are writing everything what I'm speaking, so it's nice. I hope some of the questions are answered. I hope something you learned today about kurchi. Anyone? And I hope you have heard the name kurchi. That is also very, very important because kurchi is a name which surprisingly not everybody has heard. I don't think it's an Indian plant, so it is the Mater Medica would be read from the Drugs of Hindustan. If you read from there also, these symptoms are the most important which I have seen. Add to that some symptom in relation to stomach disorders because it is a bitter tonic also. So this is for kurchi, and let us go forward. Now, there are some remedies. There are some. I hope Dr. Raha also would have got some insight of treating those cases. I have got something. Yeah, in diarrhea. So that's why I wanted to tell you, kurchi is a very famous remedy for diarrhea, but there are something else symptoms also which I wanted to share. I hope you have gained something more today of Mater Medica of kurchi. That is the most important thing which I want you to learn from my experience. I'll just, have one thing. I'll just see where sometimes in understanding rubrics, there are some rubrics, which basically are overloaded with one word. For example, there is one rubric called as the patient comes and tells us, sir, for example, Dr. Raha's question also. Some patients come to us and say, sir, no, sir, I don't need your help. I'll manage. I'm suffering from diabetes, but I don't need your help. I've come from my daughter, for my wife, for my friend. Treat him. I feel I'll be able to manage that. Now, what is this called as? You can also take the rubric which I have told you, that he says he's fine even though he's sick. You can also take one rubric. You can also take one rubric that is called as self-sufficient. Self-sufficient, he does not need anybody's help. Self-sufficient, he does not need anybody's help. This is also a rubric. So sometimes if you take a rubric, well, the patient feels well in spite of disease, the patient feels well in spite of suffering from a disease, but this is also a rubric, self-sufficient, does not need anybody's help. And you'll be surprised, there are two remedies, that first is carb, and I think second is calcarea carb. So in homeopathy, it is also very, very important to understand what to take and what not to take. I hope you are understanding, everyone. And if you club that rubric, if you club that rubric, for example, self-sufficient needs no help, and well, even if the patient is very much sick, in both the rubrics, all the remedies are different. All the remedies are different. There's one more rubric called as well, feels very. He feels very well. You don't ask him. In that also, self-sufficient rubric, well, feels very, and says well in spite of being sick. In all the three rubrics, there are no remedies which would match. All remedies are different. One would have arnica in well when he's sick, one would have feels very well ozone, and one would have self-sufficient, does not need anybody's help, there calcarecum and maccarb. So this is homeopathy. What symptom to take for, in spite of your great knowledge of repertory and great knowledge of mater medica and organon, if you are not able to pick which symptom to prescribe, remember my words, if you are not able to pick which symptom to prescribe, then your knowledge will not convert into remedy selection. That's why I always tell everybody, join a physician who can teach you the experience. He knows that when the patient is telling you in this way, you have to catch this rubric. Otherwise, some rubrics basically are very normal. Some patients come and tell me, sir, this patient is very, very violent and angry at home, but when he comes out, he is very sad. He does not speak. And everybody will take one rubric, contemptuous, hard on inferiors, soft on superiors. Sometimes, it is maturity. You know where to speak and you know where not to speak. Theoretically speaking, that rubric would fit. So if somebody is teaching you that rubric, you are very happy, oh my God, what knowledge he has. But in your patient, if a patient is sitting in front of you, and if you're a doctor who has already experienced for 25-30 years, you basically have a decorum you have an aura around your practice, around your clinic. So a patient comes with that aura, he comes with a reference. So sometimes, like for instance, that patient comes to you and he cannot misbehave in front of you, though he is that quality patient, inciting. He will not incite you because he knows that he has come with a reference and he knows that you are the last hope. So choosing a symptom, understanding what to choose in the patient personality, and then repeat that symptom, my dear friends. Otherwise, repertory knowledge everybody has. Every WhatsApp Academy, you get up in the morning and you have the psoric symptoms of calcarea, the psychotic symptoms of calcarea, and the syphilitic symptoms of calcarea. And you are doing case taking and you find, I have got all the psychotic symptoms, but Dr. Chimthanagal told me in syphilitic case, understand syphilitic symptom. And then you try to understand the syphilitic symptom and you mess up the case. So Dr. Abdequaem is there to guide you, but it is your experience in understanding which symptom to take for prescription. I hope you're understanding what I want to tell you. Yeah, everyone. This is a very important thing. Otherwise, there are so many rubrics, there are so many rubrics which I want to discuss with you. But when I see my students who are working with me telling some rubric which I feel, why did you take this rubric for prescription? The patient has, sometimes a 5 minutes, a 10 minutes case can give you the whole drug picture, the whole rubric to prescribe, rather than you take a case for 1 hour and nothing is there. Are you with me? How does a patient behave in a disease process? Otherwise, you take a case of a 50-year-old man and he says that I had a very dominating father, dominating mother, XYZ, XYZ, and he comes to you and you say, oh, there was dominance, so I have to take the rubric element from dominance. But what has changed because of his disease is very important to take for prescription. Are you with me? That is what Hahnemann tells us in case taking. What has changed from SORA when you are suffering from a disease, that is very, very important. And the normal symptom of a disease, just wipe it out and then get the remedy. Okay, that is how I practice. You can always ask who a doctor is working with me, that how I practice, how do I get the results, and do I get the results. That is very, very important. 1 or 2 sporadic case of any disease, everybody is going to cure, because homeopathy is a beautiful science. Polycrest covers everything. Polycrest covers everything, and there's a problem. So please make sure that you understand what to prescribe. Are you with me? Sir, one patient has always white spot on shirt and pant due to perspiration. It makes clothes hard and tough. Yeah, very nice. It's a very, very good symptom, and I feel that everybody should answer this question, not me. This is a very, very, you just go to perspiration, and first of all, make sure when the patient comes and tells you I perspire too much, don't always give Muxol, because we have been taught so much in a college, increase perspiration, give Muxol. Muxol is there, but there are a lot of remedies who have perspiration. And in your case, it is staining the linen. It is staining the linen, Linen. And what is the stain? It is white. Sometimes, because of salt accumulation, XYZ, there are some white stains, but it is stiffening the linen. You say it is stiffening the linen. Now, this is a very, very important symptom. It stiffens the linen. The remedy you must think about is Merxol, Natramur, and if my memory is good, there is one more remedy. I think it is selenium. I don't know. Please go and check it. But the rubric to be taken is important. It is stiffening the linen, a very, very important psychosyphilitic symptom. Merxol, Natramur, I am very sure these 2 remedies there. Selenium, you go and check if it is there or not. But if you are not able to understand whether to take white spot or yellow spots in the linen, then you can take just one rubric, stiffening the linen. Then you have a lot of remedies. Then you have lachesis, you have belladonna, you have lycopodium, and a lot of remedies. So far, not much has changed. When the duck gets back up after falling on its back, it stands still for a quiet walk, remaining motionless like a statue. Yeah, so just Dr. Babil, just send me the video so I'll be able to understand it better. One more video. I've seen one video. One more video with its head tilted to the right. Yeah. So let's see. You just send one more video. The previous video which you have sent me, I was not able to understand that properly. So just send me one more video so I'll be able to understand it better. Okay. Yeah. So stiffening of the linen is okay. Everyone, doctor who has asked me. Stiff the linen. So we have stiffen the linen, green, red, white, brown, or darker also. Green, I have only a sporadic case which I have seen in my practice, but yellow stiffening of the linen I have seen in many of cases. You can see yellow stiffening in Carboanimalis, in Graphitis, in Lachesis, in Merxol, in Thuja, where the linen is yellow in color. Normally, when there is a lot of heat in Nagpur, the temperature becomes 45, 46 also degrees Celsius. You can have white, staining because of salt deposition also. So it sometimes becomes a normal symptom. But stiffen the linen because of perspiration. I hope you understand. It could be dark in color. And one more symptom, my dear friend, understand that if the patient comes and tells you, okay sir, it is white, then I wash it. After washing also, the stiffening does not go. It is very, or he says that I have to wash lot many of times, then it goes. Means it is very difficult to wash. Are you with me? Very difficult to wash. My dear friends, then the remedy is lac defloratum mac carb. I have seen lac defloratum has got a fantastic results with this symptom when the stiffening of the linen is very difficult to wash. Please give some advice for new practitioner. The advice would be read Mathematics every day and do follow some doctors who have good practice, who have good clinical knowledge. Okay, I think it's already half an hour up. Dr. Babal has one question. What does right-sided torriculitis mean in repertory? Do the head turn to right is the cause of the left-sided? No. There are rubrics. Head tilted to one side. It is there, and I am not sure, but torriculitis directly would be one of the there is torriculitis also is a rubric. If I am not wrong, I have seen that rubric in NER repertory. If I am not wrong, or you can think that torriculitis in complete repertory also there is a rubric torriculitis, and we have remedies like I think phosphorus is there, lycopodium is there, nux is there, lacnanthus is also there, and drawn to the right side. So drawn to the right side basically is lycopodium and cuprum metallicum. Surprisingly, drawn to the left side is nux, lycopodium and phosphorus. Okay, so just send me a video, Dr. Babal, and I'll study and get back to you. So thank you everyone. Thank you for joining, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Until next Thursday for my Instagram live. Thank you.